And with respect to the multiple sclerosis, multiple white matter plaques, in case of T1, it should be low signal. And in case of T2, it should be high signal. Which type of sequence is most commonly used in case of multiple sclerosis? T1
FLAIR.
or T2 or FLAIR or star pattern?
FLAIR.
Yes. In case of multiple sclerosis, we commonly go for the FLAIR sequence. And in case of decompensated thyroid eye disease, which sequence is most commonly used?
Star.
Yes, in case the star pattern is most commonly used. So what is this structure?
Kidney.
Yeah, this is the kidney, and the renal cyst is looking as dark. So is this T1 or T2?
T1.
Yeah, this is T1. And look at here, in case of T2, it will appear as hyper intense. So next one is the FLAIR sequence. So FLAIR is the fluid-attenuated inversion recovery. So in case of FLAIR sequence, we'll remove signal from the CSF. So the CSF will appear as dark. So in case of FLAIR image, the aim or principle is to nullify or cancel the signal from the fluid. So in case of T1 image, in case of T1 sequence, the CSF is normally dark. So T1 FLAIR will also be dark, but the normal T2 sequence, the CSF would be bright. But if we go for T2 FLAIR, so the FLAIR will nullify or cancel the signal from the fluid. So T2 FLAIR image, the CSF will appear as dark. Brain tissue on FLAIR image appears similar to T2 weighted image. Gray matter brighter than the white matter, but the CSF is dark instead of the bright. So the CSF would be dark in case of T1 and in case of FLAIR image, and the CSF would be bright in case of T2. And the physics behind the FLAIR image is to null or to cancel the signal from the fluid, the inversion time Ti of the FLAIR pulse sequence is adjusted such that at equilibrium there is no net transverse magnetization of the fluid. So just remember this line: in case of FLAIR, the signal is removed from the fluid. So fluid will appear as dark in the FLAIR sequence. FLAIR, fluid-attenuated inversion recovery, MRI, is an imaging technique used to suppress the signal from the fluids in the body and improve the contrast between the fluids and surrounding tissues. FLAIR MRI is a special type of MRI sequence used predominantly in neurological imaging to enhance the visibility of lesions and abnormalities in the brain and the spinal cord, especially in case of multiple sclerosis.